Does the thought of injecting yourself with a medication send a chill down your spine? You're not alone. I know that feeling. The shaking hands, the deep breaths. What if I told you you can master this right from your own home with confidence? Today, we're not just learning to inject Tyenne, we're learning to take back control one precise, confident step at a time. We're going to break down every single step, from preparing your space and yourself to mastering both the Tyenne prefilled syringe and the Tyenne autoinjector. And stick around because I'll also reveal the one crucial step after the injection that many overlook, but that can make all the difference in the long-term comfort and safety. You'll feel completely prepared to handle Tyenne injection with confidence. First things first, preparation is key for a comfortable and safe injection. You'll need your Tyenne prefilled syringe or autoinjector. Make sure it's at room temperature for at least 30 minutes. Don't warm it up in any other way. You'll also need an alcohol swab, a cotton ball or gauze or Band-Aid, and a sharps disposal container. Before you do anything else, always verify the expiration date on your Tyenne carton or syringe. If it's expired, do not use it. Get a new one from your pharmacy or doctor's office. Most importantly, wash your hands thoroughly with soap and water. This prevents infection. Now let's talk about the injection site. You can use your thigh or your abdomen, avoiding the belly button by at least 2 inches. Rotate your sites. With each injection, this helps prevent the skin irritation. Use a spot that isn't red, tender, or hard. Clean the area with an alcohol swab and let it air dry completely. Do not touch it again until you're ready to. All right, let's walk through the Tyenne prefilled syringe. Clean the injection site as such. Let the area air dry. During this time, you'll want to check your Tyenne prefilled syringe and check the liquid. It should be clear to slightly yellowish without any particles, and don't use it if it's cloudy or has large particles. Next, you'll want to carefully remove the cap and don't let the needle don't touch the needle, and also don't let it touch any surface. Next things next, you want to pinch the skin, and you'll insert the entire needle into the pinched skin at a 45-degree angle. The needle fully in, slowly push the plunger all the way down until the syringe is empty. Take your time with this, count to 5, count to 10. This isn't a race. It's about a precise, calm moment for your entire body. Once empty, pull the syringe straight out of your skin and then release the skin. You can apply a cotton ball or a Band-Aid to the injection site if needed, but don't rub the area. A small drop of blood or a little bruising is normal. Now, for those using the Tyenne autoinjector, it's designed to make injections even simpler. Just like with the prefilled syringe, you want to check the liquid through the viewing window. Make sure that the liquid is clear. Let it air dry. You'll want to hold the auto-injector like this, and you'll want to remove the cap. You'll want to place the clear end of the auto-injector flat and firmly against your skin at a 90-degree angle. Press firmly down. You'll hear a click indicating the injection has started. Keep holding it against your skin, and you'll hear a second click, which means the injection is complete. After the second click, wait a few seconds before removing the auto-injector straight up from your skin. The needle will automatically retract for safety. Again, apply a cotton ball or Band-Aid if needed, but don't rub. The medication is in, but your journey isn't quite over yet. In fact, what you need to do next is just as critical. And it's a step many patients, even experienced ones, often overlook. Never recap your needle. Immediately dispose of your used prefilled syringe or auto-injector in a sharps disposal container. These are specifically designed puncture-resistant containers. This isn't just about tidiness, it's about protecting your loved ones. your community, and the environment. Sharp safety is non-negotiable, and it's easier than you think. When your sharps container is almost full, follow your community guidelines for proper disposal. You can find more information regarding sharps disposal and state-specific instructions on the FDA's website at http://www.fda.gov/safe sharps disposal. Remember to keep all Tyenne products and disposal containers out of the reach of children. You started this video perhaps feeling a little anxious and maybe a little overwhelmed, but look what you've accomplished. You faced a challenge head on and you emerged more capable, more independent. It's you taking control, you making informed decisions, you actively participating in your journey towards better health. If this guide helped you conquer your injection fears, hit that like button and subscribe for more RheumDoctor insights. You got this.